Hey guys, it's Michael, and I wanted to talk to you about finding a DBT therapist for borderline personality disorder. I was fortunate in my search a few years ago to be able to have several options in Tampa Bay, where I live, and here in Florida, and I was really lucky because there's a lot of cities out there that don't have DBT therapists in their cities. So I'm going to talk to you about DBT therapists and other options if there's no DBT therapists available. So if you're borderline or BPD, or you know somebody, a loved one that has BPD, and you're looking for a therapist, the first thing you want to do is find somebody that's a DBT adherent, what's called DBT adherent, which means they went through a certification process to get licensed. And that certification is fairly new, so not everybody is DBT certified. In fact, DBT itself, if you've done any research on it, is only new to the scene. It's pretty new to the scene of psychotherapy. So even that's DBT in general is still catching on. So if you're looking for a DBT therapist, you want to find somebody that's adherent. And some of the ways to know if somebody's DBT adherent, or if it's what we consider, or the industry considers, true DBT, is first, of course, asking them if they're certified. And there's a couple other things that are true indicators. The first is if you go to a DBT, there's a DBT group that you have to attend every week. And that is a group with other people suffering from usually BPD, but it could be other disorders like anxiety, bipolar, whatever. So there's a group session that you do once a week, and the other part of that is the therapy session. If the therapist that you're interviewing only teaches DBT, but that there's no group attached to that, then it's not true DBT, or how it was designed and developed for. And I'm going to talk a little bit about the group in DBT. So there's a group setting aside from your hour therapy session. And that takes place usually with about 5 to 7 students. It depends. It varies from class to class. But basically, that is a chance to practice skills with other people and process information and learn in a group setting. And that was really key for me on my path and my healing, because having other people in the group share their experiences and what their setbacks using the things taught in DBT helped me to progress. So when you're talking to therapists, you want to ask if they're DBT adherent and if they offer a group therapy in addition to the one-on-one session that you do every week. So those are the big tells and the big knows if it's true DBT. But there are a lot of people in a lot of cities, like I said, that still don't have DBT. So what do you do in that situation? And that's debated in the mental health community. But in my opinion, I think something's better than nothing. Whereas some mental health professionals think, well, if it's not DBT adherent, well, then they shouldn't do it. And like I said, I tend to disagree with that. And so I think having something is better than nothing. So if somebody says they offer DBT but they don't offer a group session, and that's the only thing in your city, and you can't drive anywhere else that's close by. I've known people that have driven 2-3 hours to go to DBT, so and they're really motivated. But if you don't have that option, and somebody will teach you DBT skills, then go with that. Please go with that. And then the universe will provide something later on, but at least it's something. If you can't get DBT adherent, find somebody that does teach the DBT skills. And if you can't find that, then cognitive behavioral therapy is probably the next best thing. DBT actually mixes cognitive behavioral therapy with mindfulness. So I definitely would suggest at the very least doing some cognitive behavioral therapy if you can't do dialectical behavioral therapy. So yeah, thank you for listening. And there's resources on my blog for therapists and all that good stuff, throughout the country and in Florida. And you can check that out on my blog. So thank you for tuning in, and I will talk to you later.